Quantitative assessment of proteinuria. Today's spotlight is on Bence Jones proteinuria, myoglobinuria, and tubular proteinuria, including key markers for acute kidney injury, AKI. If you're studying for the ASCP exam, we've got you covered with clear and concise explanations. Show your support by hitting that like button and subscribing if you haven't already. Let's get started. Bence Jones proteinuria, a marker for myeloma. Significance: Bence Jones proteins are small immunoglobulin-like chains that can appear in your urine. They're a red flag for multiple myeloma and show up in about 20% of cases without serum paraprotein bands. Detection methods: the best way to detect these proteins is electrophoresis with immunofixation. These advanced techniques have replaced outdated tests like the heat test and Bradshaw test. Monitoring: for patients with light chain-only myeloma, protein levels are tracked using either densitometry with electrophoresis or specialized immunoassays for kappa and lambda serum-free light chains. Myoglobinuria, rhabdomyolysis and kidney injury. What is myoglobinuria? Myoglobin, a small heme-containing protein, is usually reabsorbed by the kidneys. But during rhabdomyolysis, when muscle cells break down, myoglobin floods the bloodstream and overwhelms the kidneys. Clinical signs: this can lead to red-brown urine and acute kidney damage, including acute tubular necrosis, ATN. Detection tools. Simple tests like reagent strips for hemoglobin might help, but they're prone to errors. Advanced immunochemical methods are more reliable but often require pre-concentration of urine samples. Pro tip: serum creatine kinase, CK, levels are a more accurate marker for diagnosing rhabdomyolysis than urine myoglobin. Tubular proteinuria and acute kidney injury markers. Understanding tubular proteinuria: when kidney tubules fail to reabsorb small proteins, these proteins leak into urine, signaling potential damage. Key markers of tubular damage. Alpha-1 microglobulin, stable and reliable for detecting tubular damage. Beta-2 microglobulin and retinol-binding protein, RBP useful but limited by instability in certain pH conditions. Cystatin C, while mainly used for measuring glomerular filtration rate, GFR, its presence in urine points to proximal tubular damage. Enzyme markers. N-acetyl-beta-deglucosaminidase, NAG, a sensitive marker for kidney damage, often used in hypertension or drug nephrotoxicity cases. Glutathione S-transferase isoenzymes, these enzymes help differentiate proximal from distal tubular damage, though they're less commonly used. Advanced biomarkers for acute kidney injury, AKI. Emerging biomarkers, traditional AKI markers like serum creatinine fall short in early detection. Enter NGL, neutrophil gelatinase-associated lipocolin, KIM-1, kidney injury molecule, 1, IL-18, and TMP2, which detect changes within hours of AKI onset. NGAL and KIM-1. Both urine and plasma NGAL are effective predictors of AKI, even when urine samples aren't available. These markers are stable and offer valuable insights into kidney health. Biological variation: urinary biomarkers can vary significantly between individuals based on factors like age, gender, and underlying conditions like chronic kidney disease, CKD. Proteinuria patterns and diagnostic techniques. Glomerular damage and proteinuria. Increased glomerular damage lets large proteins leak into urine, helping assess kidney filtration efficiency. Diagnostic tools. The hydrogel system uses SDS-agarose gel electrophoresis to separate proteins by size, distinguishing between glomerular and tubular patterns. Protein panels including albumin, alpha-1 microglobulin, and IgG can pinpoint the source of kidney issues. Preferred methods: immunoassays are the gold standard for quantifying specific proteins, ensuring sensitivity and accuracy. Impact of glomerular damage on proteinuria. What happens during glomerular damage? When the glomerular membrane is damaged, its permeability increases. This allows large, high molecular weight proteins to leak into the urine, something that shouldn't normally happen. How do we measure it? Protein clearance rates. These are used to evaluate the extent of glomerular damage and how selective the membrane is at filtering proteins. Protein selectivity index. Although it's been studied, this measure has limited diagnostic value in clinical practice. Qualitative analysis of urinary proteins. The hydrogel system, SDS agarose gel electrophoresis. This advanced technique separates proteins based on their molecular size. Why it matters: it allows clinicians to 1. Identify whether proteinuria is glomerular, tubular, or mixed in origin. 2. Detect and quantify conditions like Bence Jones proteinuria, often associated with multiple myeloma. Differential diagnosis using protein panels. Protein panels for diagnosis. Panels measuring proteins like albumin, alpha-1 microglobulin, IgG, and alpha-2 macroglobulin help distinguish between prerenal and postrenal diseases. Example: combining reagent strip tests for hematuria, leukocyturia, and proteinuria with expert diagnostic systems achieves impressive accuracy, 98% concordance in clinical settings. Preferred analytical methods for individual proteins. Why immunoassays are the gold standard. Immunoassays provide precise and sensitive quantification of specific proteins. Techniques used include immunodiffusion and electroimmunoassay, particle-enhanced light scattering assays, labeled immunometric assays. Pro tip: light scattering immunoassays using turbidimetric or nephelometric detection are widely used due to their efficiency and accuracy. NGL measurement, a breakthrough for kidney injury. What is NGL? NGL, neutrophil gelatinase-associated lipocolin, is an emerging biomarker for kidney injury, measured in urine or plasma. How do we test for it? Automated platforms. Devices like Abbott Laboratories' urine-specific immunoassay systems make NGL testing efficient. Point-of-care devices. Tools like Triage BioSite, BioLira Incorporated, allow for whole blood analysis at the bedside. Challenges in NGL testing. Variability between NGAL assays exists due to differences in epitope recognition and standardization challenges. Some assays detect the dimeric form of NGAL, from neutrophils, more efficiently than the monomeric form, from renal injury. Factors affecting NGAL levels. Age, gender, leukocyturia, and chronic kidney disease, CKD, can influence reference intervals, so these factors must be accounted for during analysis. Enzymuria measurement, markers of tubular damage. What is enzymuria? The presence of specific enzymes in urine signals kidney tubule injury. Common detection methods. NAG, N-acetyl-beta-deglucosaminidase, assays are a key tool. Example: the 4-methylumbelloferril N-acetyl-beta-deglucosaminide substrate uses fluorometric detection for sensitivity. Alternative substrates with visible spectrum detection are also available for broader clinical use. Thanks for joining us today as we explored Bence Jones proteinuria, myoglobinuria, and tubular markers of acute kidney injury. We hope this helped simplify key concepts for your ASCP prep and gave you the confidence to tackle these topics. If you found this video helpful, don't forget to like, subscribe, and turn on the notification bell so you don't miss our next upload. Keep studying, keep learning, and we'll see you in the next video. Take care and good luck.